Audio Jungle.
This is Dr. Denise Norton. I'm a surgeon and I specialize in taking care of patients with vein problems. Vein problems can be very simple to complex. They can be anything from spider veins to varicose veins. And what we're going to talk about today is the treatment and evaluation for someone who has varicose veins. So everybody's treatment is individualized and it's based on assessment with ultrasound. Ultrasound lets you see what the underlying medical problem is, not just what you can visualize when you look at someone's leg. So the ultrasound helps to map out the abnormality, it helps map out the medical problem, and it helps with the treatment plan. So treatments can vary from a simple procedure called sclerotherapy, where we use medications to treat the vein, or it could be a treatment where we use a laser. And everybody's treatment plan is different depending on what their circulation abnormality is. What the ultrasound does is it helps us to determine for the treatment where we need to use the laser, where we need to use sclerotherapy. We also do a treatment called a microphlebectomy for areas of the vein that are very dilated. So the laser procedure is done for feeding veins that are under the surface that you can't see. The laser filament is a straight fiber, and so it can only be used in segments of the vein that are fairly straight. So under ultrasound, we're able to see where the abnormal feeding vein is. We put the laser inside the vein, and then we put some numbing medication around the vein, and then the laser seals up and closes that vein by using an energy form. So the laser procedure is considered minimally invasive. The access is done through a small puncture site the size of a tiny needle. And so at the end of the procedure, there's a small scab that forms where the laser goes into the skin. In contrast to the surgical procedures we used to do where we did strippings and there were large incisions, this is a small puncture. Theoretically, there's a small risk of infection. The most common problem that people have is bruising afterwards. And the bruising can be very pronounced sometimes that first week, and then it quickly fades away. There are some little tiny scars about the size of a freckle where the procedures are done, and those frequently fade away and are barely visible. We have patients who can go back to work the next day. It depends on how physical your work is. For example, people who are in construction, do a lot of heavy lifting, or who may be on their feet for long periods of time would probably like to take 1 or 2 days of just taking it easy. There's 2 weeks of restriction. The first 2 weeks we want you active but not doing anything aerobic. So that means walking, going up and down stairs, doing your normal day-to-day activities, driving a car, going to work. And in the first 2 weeks we have our patients, we ask that they wear a compression sock. And so recovery is pretty quick. Most people take a little bit of ibuprofen to help with some of the inflammation after the procedure. It's very rare that anybody needs any medication stronger than ibuprofen.